And then do you want to turn the light on, the lamp? So I'm going to take a look around the entire oral cavity, but I'm also going to check the surgical site. Close up a little bit. Okay. So right now I'm going to skip to the part where I place the perio pack. Like I said, just so we have something to remove. You're going to want to put some Vaseline on the fingertips of one of the gloves. And this is the perio pack here. I have it on a dry angle. I'm going to grab it off of there, and I'm going to form it into a bit of a saucer. And I'm just going to take my little 2x2 and just dry the area. And then I literally just place it right along the cervical third of the teeth, and I'm going to push it into the interdental space. Do you want to just zoom that? I think you have to do it on the remote. Okay. And like I mentioned earlier, it is a light cure material.
Sorry, I am.
Okay.
It's not working. I think it's zoomed as much as it's zooming.
Okay, that's fine.
Yeah.
So I'm going to do, sorry, I was tickling your nose. I'm going to do 10 seconds on the mesial aspect of that, and then sort of the center, and then the distal. But again, you're not placing these, but you might help the dentist place them, so you would likely be the person that is doing the curing.
And the stuff, it sets up fairly hard. It's not extremely hard, but almost like a rubbery consistency.
Okay. So it's gum flavored too.
Gum flavored?
Or gum colored. We purposely gum flavored. We purposely make it match the tissue so that if the patient has to go to work the next day, it's not this like weird blue or green stuff that's stuck to their gum. So, Alyssa, I'm just going to. Everything looks really good in there. I'm going to give you a little bit of a rinse here. So you want to debride the area with either some sterile saline, or you can have some diluted scope in your monojet syringe.
Technical difficulty.
And I've just got plain old tap water, okay? Okay, so just a little bit of a rinse here, Alyssa. And really gently, okay? I don't want to drag my monojet on the tissues at all. Oftentimes when the patient comes back to have the perio dressing removed, there's food caught around the margins. Okay, so now I'm just going to take my PFI, and we're all familiar with this. These aren't the metal ones that we have in the Resto kit. These ones are more of a plastic material. I'll show you what that looks like. And I'm going to start at one end, and don't forget your fulcrum. And what I do is I'm just going to find one corner that I can lift. And this guy is stuck on really good. And you let me know if okay, so it started lifting on the 1-1, and what I want to do is I want to loosen it in its entirety, and then I'm going to grab my cotton pliers and I'm going to remove it from the surgical area, okay? And we want to make sure it is all intact, that there's no pieces missing. So I'm going to take a little look at it and close up a bit. Oh, that looks really good. Yeah, that healed nice. And I'm going to give my patient another little rinse, okay? Because now I've exposed the surgical site and the sutures. So just another little warm rinse here. Alyssa, are you doing okay? All right. There we go. And that is how you remove a periodontal dressing. My next step is I noticed on Alyssa's chart that there were a couple of silk sutures that were placed in the surgery. So what we do is we place these cotton rolls in the vestibule with the sutures facing out to simulate that it's in a surgical site. When you do this, I'm doing this in the anterior region right now so that you can see it, but when you do this in the chair in practice, I want you to place it in the posterior region, and I want you to remove one of these sutures upper posterior, and I want you to remove one lower posterior, because it's a little trickier to get back into the posterior area with retraction, but for this demo it's just a lot easier if I just keep it in the front. And I see that there are still 2 sutures in place. I'm going to take my cotton pliers and I'm just going to loosen them a little bit just to see where the knots are. Sometimes the knots get buried. Oh, my hand is covering that. Oftentimes the knots will get buried by tissue or debris. And so before I come in here with my suture scissors, I just want to make sure that I have full access to that knot. All right. The next thing I'm going to do is I'm going to take my suture scissors and I'm just going to hold this in front of you. You can see, maybe I'll do it like they do on the shopping channel. You can see the upper beak has a bit of a half moon crescent in it, and that's the part of the scissors that you're going to hook under the suture to cut it. All right, so with my scissors in my dominant hand, I'm going to hold the knot of my suture with my cotton pliers, and I am going to cut. Let me know if my hand's in the way.
Actually, you have to retract a little bit with your other finger.
Okay.
Yeah.
Okay. And I am going to cut this suture as close to the tissue as possible. Not close to the knot, because I don't want to drag all that dirty suture through the tissue. And you certainly don't want to drag the knot through the tissue. So I will tell the patient, this is, if they feel it, it might be a little sensitive. It doesn't take very long. And then I'm going to make sure that I have the whole suture in place. Okay, and there were 2 sutures there, so again I'm going to take my cotton pliers. I'm going to do this so you can see, and I'm going to expose my knot. There we go. You could do this all in one fell swoop if you wanted, if you're moving 2. And now I'm going to grab my suture scissors with my dominant hand. And the hook, the little half moon part, that goes under the suture, okay? Don't put the blunt end under the suture because it won't cut very, very well. So when you're doing this in the operatories, it is a struggle to retract the lip, grab hold of the knot, and I'm kind of cheating here because I pulled it out of the oral cavity, and cut the suture at the same time. Can you see, Lorna?
Mm-hmm. Yep.
So there's where it's coming out of the tissue.
There we go.
And there's my suture. And again, I want to put it on my 2x2, and I want to make sure that they're both intact. If I know my doctor's coming in, and if he's really picky, I'll let them take a look at that. To make sure that they're satisfied with everything being removed. And then the last thing I'm going to do is I'm going to give my patient another rinse. Sometimes this will cause a bit of bleeding, and that's normal. So you can tell your patient it's normal to have a little bleeding. If it's bleeding a lot, just put a little damp 2x2 up there, like just fold it in half and then in half again, and you can just place it. And usually by the time the patient leaves the office, it's not bleeding anymore. Okay. And how are you doing, Alyssa? So the healing looks really good.
It's like nothing was ever done.
Right? So doctor's gonna come in and just double check that.